Hi, I'm Stephen, your host for Ethically Sourced. This is the first part of a two-part discussion on the ethical and equitable distribution of the COVID-19 vaccine. We're back for another episode of Ethically Sourced. I'm privileged to be joined with Dr. Kevin Simon. He is a psychiatrist and he's completing some additional fellowships in the Harvard medical system at the moment. He works on the ethics board at his hospital and he's well read on the subjects. So he actually brought one of these articles to my attention. I'm looking forward to digging into this more.
Stephen, it's a pleasure to be here again, man. This is a important topic given that the rollout of the COVID-19 vaccine is currently going on.
So what's your experience with clinical medical ethics?
That actually started in residency, and I was at Morehouse School of Medicine. That's in Atlanta, Georgia. And so the primary hospital that I was with was Grady Memorial Hospital, or Grady as most people just call it. And that's the largest public hospital in Georgia. And there I had the opportunity for the final 2 years of my residency to be on the ethics committee and the ethics consult service. So oftentimes, if there's a question regarding end of life or medication management or dispute for a loved one, the primary team could consult ethics, and we could come in and have a conversation between the providers, the team, and come up with a reasonable solution with regards to the problem at hand. And the ethics committee classically is composed of psychiatrists, OB-GYN, general internist, persons from the community, lawyers for the hospital. So you want a robust, diverse set of personnel in the ethics committee. And then here at Children's, which is the hospital I'm at, again, with regards to the ethics committee, it's a robust collection of providers of different specialties. And so it happened to be that it started in residency that I had interest in ethics. And there's this whole field of medical ethics, so I may even pursue some additional training down the line.
So for today, we're going to actually delve into a couple of different articles and some of the CDC guidelines on this important issue. As we know, the COVID-19 vaccines are out and have been administered to thousands of people. And we're going to look at how this rollout occurred and what is the plan for further administration and distribution of this vaccine. So Kevin, let's talk about your experience. How was it getting vaccinated? How did you sign up? Just give us the details.
Yeah, so my hospital is one of the few hospitals in the state that has the sub-zero freezer that's required for the Pfizer vaccine. And so Pfizer is the manufacturer that we're distributing. And really for us, my department, so I happen to have two homes, one Department of Pediatrics, one in Department of Psychiatry. Department of Psychiatry, had an email that was sent out to say that those who are, routinely in the hospital and want to receive the vaccine, sign up. And so I signed up, and I believe I got mine on 2 Tuesdays ago, whatever date that is. And really just sign up, show up, and get checked in. They ask you the standard questions, fever, cough, travel. Have you gotten a vaccine in the past 2 weeks? You say no to all those things. A nice nurse, popped my shoulder with a little honestly, the needle was very small. I really didn't feel it. And then afterwards, you wait. I waited in the auditorium for 10 to 15 minutes just to make sure I didn't have any kind of anaphylaxis or any other, sequelae. And then I scheduled my next shot, and so I'm supposed to get the second one on January 12th at around 6:30 or 7 o'clock. And a part of the monitoring system for the vaccine, and I think this occurs for both Pfizer and Moderna, I think it's the CDC has something called VSafe, so I think vaccine safety protocol, where I get a text message that prompts me every day to say, hey, have you had any symptoms, fever, etc. If I say no, I just log that in, and that's a way that they're monitoring in real time all the thousands of personnel that have received the vaccine. And so again, I think that's for the CDC, not specifically for the hospital that I work for. So really for me, the rollout, even prior to signing up, the hospital made sure that they had experts that are in immunology, experts that are in virology, talk about the vaccine, talk about the mechanism of it, so that way you can be, well prepared if you volunteer to receive it. Because that's the other thing that I think, sometimes gets misconstrued. It is voluntary. No one's mandating that I get it, or that the staff get it, but they, do strongly encourage, given the severity that we do see regarding COVID-19. So for me, the experience has actually been quite anticlimactic, which I think it's supposed to be. Just a normal phase, just like, getting the annual flu vaccine has been, no issue for me. So I've told my coworkers, what the steps were, and some said, oh, you know what? Now hearing you talk about, you check in and kind of knowing the actual steps assuage some of their own anxiety, and some have gone on to receive it.
Nice. So let me ask you this, because under the emergency use authorization, these medications or these vaccines were released, but there is still a protocol or recommendation for the allocation, and it starts with phase 1A, which are healthcare workers and long-term care facility residents. Did you have to verify, or how did they verify that you were in this phase 1A community?
Yes, I think that's because I'm in the hospital. So given that the facility that was distributing it is the hospital, they're aware of, who is a physician, who's seeing patients in person. And so I think that's how they verified that I am who I say I am. And then again, when you walk in and you get checked in, it's not that I just, oh, hey, I'm Kevin, I'm here for the shot. They look at my badge. They assure that I am who I am. I show them my ID. So I think that's one of the ways that they get at, okay, you are who you say you are, and you're part of this, first phase that should be receiving the vaccine if they want to.
Gotcha. We'll kind of circle back around to that in a little bit. As we go forward, we're talking about ethics. So I know in medical school and most people in healthcare with kind of the bird's eye view or the basic understanding of ethics, we realize there's the 4 core principles of medical ethics that everybody memorizes in medical school: beneficence, non-maleficence, justice, and autonomy. In other episodes, we'll kind of go deeper into those individual tenets. But Dr. Simon, when it comes to distribution of this vaccine, which ethical tenets would you think should be considered in this vaccine distribution plan?
Yeah, so I think of the core 4, I would say that justice is probably most salient, because it's the idea of, treating quote-unquote patients fairly and equitably. I think it's the equitable part that most of society is thinking about with regards to the vaccine distribution. And again, even the idea that we're talking about here, different phases, right? So, healthcare workers, those in residential nursing units. One could argue, is it necessarily equitable and justice laden that's the first group that gets it? And again, it's what we're going to be talking about later, but in reference to the principle, justice would be number 1 for me, and then the second, I think, would be autonomy, right? So we're not mandating, or the CDC isn't mandating, Pfizer and Moderna is not mandating that people get it. Employers are not mandating it. It is strongly advised, it's strongly recommended, but still the person, myself, or those who are listening, have the right to make their own self-governance of, this is something that I want to do, or this is something that I don't want to do. And if I don't want to do it, no one can pressure me into doing it. So I think that's the autonomy. And then certainly beneficence and non-maleficence are there too, in reference to, trying to get the most benefit rather than harm, and then trying to certainly avoid causing harm to people. So I think that's where, the non-maleficence, when I talked about the V-Safe app and them checking in on me, making sure that nothing's gone wrong, they are, again, trying to follow up. So justice and autonomy, I think, but I think those are the 2 most prominent for me that I think most people consciously or unconsciously are thinking about when they hear about the vaccine distribution.
Yeah, I think that is very accurate. And there's an article that came out in the Journal of the American Medical Association. This is October 22nd of 2020. The article is entitled Scientific and Ethical Principles Underlying Recommendations from the Advisory Committee on Immunization Practices for COVID-19 Vaccine Implementation. In short, there is a group called the Advisory Council on Immunization Practices. They've been around for quite a while, and they help inform the Center for Disease Control on how they should allocate and distribute vaccines. The group's made up of different people from different backgrounds, physicians, scientists, and even members of the lay public. And knowing that this issue would present as they were working on the vaccine, I think they usually meet 3 or 4 times a year. They've been meeting monthly in preparation for this. And in September, this advisory council endorsed 4 interim ethical principles that were central to the development and implementation of recommendations they would make for this COVID-19 vaccine. And in the setting of the limited supply that we would be starting out with, they decided they'd focus on maximizing benefit and minimizing harm. So that sounds a lot like beneficence and non-maleficence to me. They also mentioned they would focus on equity, justice, and fairness. So I know we talk about the 4 principles of medical ethics, but there's kind of quite a few more that are out there. And the ones that are central to this vaccine being distributed are equity, justice, and fairness. And then of note, they actually mentioned transparency as a 5th principle that they were considering that would be foundational to making the right decision. So their goal was to be transparent, to foster this public trust that would kind of help with the allocation, decisions, and public engagement.
Yeah, and I think transparency is very important given the historical nature of healthcare in our society, and even in the nature of how the vaccine came to be, and the title of the project, quote unquote, warp speed, even though in theory mRNA design and study has been going on for more than 3 decades, it can give people pause to say, wait a minute, how could they make this thing so quickly, and how is it going to be distributed so widely now when, in theory, we just learned about coronavirus and COVID-19. Essentially, there was a JAMA article, Dr. Fauci actually published it, December of 2019 or January of 2020, very early in the year, had published an article talking about this novel virus from overseas coming to America and that we need to develop mechanisms to protect ourselves. In that same year, to have developed an actual vaccine really does sound almost science fiction. So I think the idea of being very transparent about how we developed it, how it's going to be distributed, is very important given the historical nature of healthcare experimentation, vaccine experimentation in America. So I think rightfully so, transparency is big on their list, and I essentially, I guess I applaud them for recognizing that they should be very transparent for the American public.
So we looked at the ethical principles that this group instituted in developing their plan. Let's take a look at their plan, because everybody has that question: how is this vaccine going to be distributed? Who is it going to go to first? And I think, on the Center for Disease Control's website, we have that information. Kevin, you have that plan for their distribution?
Yeah, so they have what they're calling different phases. So phase 1B, phase 1C, and then phase 2, and I'll just read it verbatim so that way no one's assuming we're cutting corners here. So for phase 1B, they're noting that...
And because phase 1A was the healthcare personnel and long-term care facility residents.
Yeah. So in theory, people like us, doctors, long-term care facility personnel, given that they're at greatest risk if they got COVID-19 to have worse outcomes. And then phase 1B was, so they're noting that approximately nearly 50 million persons, including frontline essential personnel, non-healthcare workers, but those, again, who are on the front line, likely in the hospital, persons over 75 years old, recommended to receive the vaccine in phase 1B of this program. And they're noting that essential workers perform duties across critical infrastructure sectors. So again, if you think about the hospital system, those are the personnel that do maintenance, that do food preparation, who really interact with a lot of people who are coming and going out in and out of the hospital.
And shout out to them, because they are the unsung heroes in all of this, because the work they do really keeps us safe and helps keep the system moving.
Very true. And you know, a small plug, because even myself, I go in the hospital and have been continuing to go in since the ramp up of COVID, and they're just there, happy, smiling, wanting to take care. They're wearing their mask. So it's pretty phenomenal to recognize that there are people who don't necessarily get, the PPE first or protective, instruments first. Yet because they, are needed, they care about the welfare of patients. They care about us as residents and fellows and attendings. That they're doing a judicious job of showing up. And so that's generally phase 1B personnel. Then there's phase 1C. And then it says the vaccine should be offered to persons aged 65 to 74, persons 16 to 64. So again, this is lumping everybody with medical conditions that increase their risk of severe COVID-19, and essential workers not previously included in the 1A or the 1B. And so they're noting that would actually be approximately 130 million persons are included in phase 1C. So again, that's older adults and then adults who have medical conditions, and then any essential worker who is not included in 1A or 1B. And it's notable because when you think about, people with medical conditions, so now this is where the information that we're seeing, one, on social media with doctors like Dr. Rutland, Dr. Drummond, who talk about the different components of COVID and how it's affecting different people, whether that's, you have asthma or diabetes or any other chronic medical conditions. You start to recognize that there are a lot of people who need to get this vaccine before we can say that we're, quote unquote, over the hump, or we're really in that next phase where we can kind of go around without a mask or doing those preventative measures. 130 million people is a lot of people.
Not quite there yet. Ways to go.
No, definitely not quite there yet. Then there is phase 2. And so phase 2 says includes all persons aged greater than or equal to 16 who are not already recommended for the vaccine in phase 1A, 1B, 1C. And it says currently, in accordance with the recommended age and condition of use, any authorized COVID-19 vaccine may be used by the time that we're getting to phase 2. So just to kind of recap, so generally for phase 1, including A, B, and C, you got clinical, non-clinical healthcare workers that are in direct contact potentially with people who have COVID-19 or SARS coronavirus, long-term care facilities, elderly folks. Then we're talking about healthcare workers doing non-COVID facing care. So again, thinking about maintenance staff, janitors, housekeeping, food services. That's all lumped into phase 1, phase 2. If you have a comorbidity, right? So chronic diseases, and you're an adult, chronic diseases and an adult, also lumped into that phase 2 category. You're going to start thinking about other people who are going to interact with a lot of people, right? So think about teachers are going to interact with a lot of people, grocery store personnel interact with a lot of people, sanitation workers, public workers. So that's generally our phase 2. And then in theory, the phase, as they would call it, phase 2, if you can further break it down technically to be like a phase 3, everybody gets it in theory as phase 3. They've broken it down in what would seem to be an equitable and just justified way. But we're recognizing that even in this early phase of what we're really only about into our second month of distribution, and we're hearing stories and reports already of persons trying to circumvent and get ahead of the line, which is unfortunate.
We're definitely getting to that in a little bit. Some crazy stories that are already popping up. Before we get to that point, within these certain groups, the question is, do some people need this vaccine sooner than others? So this article came out in the Journal of American Medical Association. The date was November 24th. This article was entitled, "Is it lawful and ethical to prioritize racial minorities for COVID-19 vaccines?" Excellent article if you get a chance to read it. Dr. Gostin is an author on here. He's done a lot of great ethics papers, especially concerning this COVID-19 pandemic. This paper, though, breaks it down and speaks to the issue of the effect COVID-19 has had on communities of color. It gives the data where in individuals identifying as Black, there's a 3.4-fold higher mortality rate compared to population size. The mortality rate in the Black community is about 131 out of 100,000. In communities of Indigenous and Latino personnel, you get a 3.3-fold higher mortality rate. So that Advisory Council on Immunization Practice actually contracted out to this organization called the National Academies of Sciences, Engineering, and Medicine. And this group actually recommended prioritization of racial minorities who are worse off socioeconomically and epidemiologically. Now, the issue of race and how you use that as a category is a whole other issue in and of itself, which we can't get into here for sake of time. But the question remains, is the ethical justification for prioritizing economically worse off racial minorities, is that legal and ethical?
Right.
Now, it is based on some of the epidemiological data that we have, and the fact that these communities have been hit harder, they've been ravaged, in fact, by this vaccine. What are your thoughts, Kevin?
So it's a great question because, one, we know that race is a social concept, right? So folks who are born in sub-Saharan Africa do not consider themselves inherently Black. It's when they migrate somewhere and are told, oh, you're Black, that then race becomes a significant factor. And so, unfortunately, in our country, race tends to be paired with a lot of unfortunate circumstances that we deem like, determinants of health, right? So you are Black by identification, what you look like phenotypically. There's a tendency that you may live in a lower income area. You may have higher rates of poverty. And so I think from the data thus far, despite race being socially created, it is impacting those who get coronavirus by worse deaths, higher hospitalizations. So the idea that those who are identifying as Black American, Black Afro-Caribbean, getting the COVID vaccine first does sound reasonable. The challenge here is the precedent that's been set by our history would indicate that it is that same exact group that is going to be the most resistant to being deemed, oh, you want me the first, right? Because it's going to be perceived as, is this experimental? Is this some trick that you're trying to do to me? And so, unfortunately, yes, Black and brown persons should probably receive it first, given the nature of the past, essentially past 11 months that we've seen. Yet, they're going to be the most resistant at receiving the vaccine. And actually, even outside of COVID-19, when we just look at vaccine numbers and distribution and administration, Black and Latinos and adult persons tend to be lower on accepting of vaccines. So now you're saying the group that most often doesn't accept vaccines to now be the first to get a truly new and novel vaccine. It's a hard road to travel for a public health personnel with regards to vaccine distribution.
Tune in next week where we'll dive deeper into this discussion on the ethics of prioritizing race and ethnicity for vaccine distribution. Thank you for joining us for another edition of Ethically Sourced, a supplement of the Black Doctors Podcast, where we focus on presenting information and resources that can proactively improve the care our patients receive. We hope that by generating these discussions on clinical medical ethics and culturally competent care, we will have a positive impact on the lives of patients that look like us.